Hi, and welcome back to Your Autism Game Plan. I'm Joya Vanderlaan, a family nurse practitioner, a functional medicine specialist, and an autism mom. Today we're going to go over OCD and anxiety. While those two things aren't necessarily part of the autism diagnosis per se, they so often accompany symptoms that an autistic child will experience that I think it's worth going over. So let's talk about anxiety and OCD. So how does anxiety manifest in children with autism? It can overlap with a lot of the symptoms of autism itself, but it can also present differently in children with autism than in their typical peers. So here are a few things to look out for when thinking about if your child with autism has anxiety. Firstly, they might be having more meltdowns or more stimming. They might have specific phobias or fears. They could, of course, have obsessive compulsive disorder, like that would be something like unwanted and intrusive thoughts, and then compulsive behaviors. And OCD and anxiety are very connected. They can also experience social anxiety or separation anxiety, or they can show that they react with distress to a change in environment or a change in routine. What can cause anxiety and OCD in children, specifically children with autism? Well, one of the main and probably most concerning symptoms, but also one of the causes that can be addressed, would be PANS or PANDAS. And I'll get into a little bit about what that is, but especially when the onset is sudden, those are things that you will want to have a medical provider look into with you. And even in the meantime, you can look up the symptoms and signs of PANS, PANDAS, and what other symptoms they may have of those things to kind of help yourself understand, is this something that you should be concerned about with your child? Other causes of anxiety can certainly be vitamin or nutrient deficiencies, elevated glutamate or low GABA in the brain, gastrointestinal issues or an imbalance in the gut microbiome, neuroinflammation or inflammation in the brain. Sometimes retained primitive reflexes that can cause anxiety. Remember, that leads to them feeling very uncomfortable and uneasy. Sometimes high histamine levels. That can also indicate that they're poor methylators, and methylation is something that we'll discuss in the future as well. But high histamine levels can certainly be associated with anxiety. And then poor adrenal function and neurotransmitter balance, because remember, our kids are often stuck too much of the time in that fight or flight response. And so that stresses out our adrenal glands, our child's adrenal glands, and then can predispose them to not being able to handle stress or anxiety as well. And then that can manifest as symptoms of anxiety. What can you do to help your child with anxiety? So as with a lot of other things, there is not usually just one thing that's going to be the magic bullet. Many times we need to use a combination of approaches to maximize the relief that they'll get. So let's talk about a few of those options. So first of all, we may need to help our child understand what anxiety is. Talk to them about what anxiety is, what it feels like, when it may happen, who experiences it. Are they the only one who experiences it? Remember, they have a hard time taking the perspective of others. And so they may think that this thing that they're feeling is unique to them. Remind them that they are not alone. Talk about how it feels physically, how it feels emotionally, what somebody might think in their brain when they are anxious. Maybe there are some books out there that can help you talk about this with your child. It is so important to talk about with them, because the more we can talk about it with our children, the more it normalizes discussions about not only anxiety, but other mental health things as well. And certainly we want that door of communication open for our children to be able to come to us and talk about mental health things. Many of the more natural treatments for anxiety do tend to sometimes take a little while to work. Now, that's true with medications as well, but it may be worth trying a medication depending on the severity of the child's anxiety and OCD. In the meantime, while you're working on other things, You may just be at that point where enough is enough and you really want to get your child help and you can't handle the anxiety and OCD in them anymore and they can't handle it anymore. So, don't be closed off to medications necessarily just because you really want the natural approach. A lot of times it can be a temporary help while you're working on other things. Some of the kind of typical medications that might be prescribed for a child with anxiety, including those with autism with anxiety, include SSRIs, for instance, like Paxil or Zoloft. Now, we want to be careful with medications with the autism kids, especially because many times our kids are more sensitive to medications and don't react typically to medications like other typically developing children or even teens or adults would. So you do want to be cautious as always with medications and really note, is this medication helping them or not? CBT, or cognitive behavioral therapy, is a certain type of therapy that many therapists are experienced in providing, but it is one of the more effective types of therapy for anxiety. And certainly with our autistic kids, it can be very helpful with the anxiety and the OCD piece. So find a therapist who is experienced in CBT and also experienced in working with children with autism. Let's talk about some more natural options for treating anxiety and OCD in our children. If you're like me, you kind of trend or lean towards the more natural options, especially at first, before heading towards medications. And again, I don't want to tell anyone that medications are bad. I think that they have a place in sometimes our lives and sometimes our children's lives. But if you're like me, again, you want to lean towards the natural stuff to try first. Magnesium. Here it is again. Magnesium, remember, helps with 250 to 300 reactions in the body. And so if we're missing it, those reactions are slowed or they don't happen. So not only can magnesium help with anxiety, but it can also help with constipation, with sleep, with detoxification, methylation, so many things. So magnesium is often a great place to start as well. GABA, or gamma aminobutyric acid. I want to make it very clear that this is no relationship to gabapentin or Neurontin, a seizure medication. No relationship at all. This is completely separate. GABA, sometimes called herbal Xanax, is a really good way to calm the nervous system. Remember, in the causes of anxiety and OCD, I mentioned that there might be low levels of GABA in the brain. So we can replace GABA by giving it supplementally. There are chewables, there are liquids, there are pills, lozenges, all sorts of different ways to give GABA. Some of the benefits to GABA, as opposed to something like Xanax, for instance, are that GABA is non-sedating, it's non-drowsy, and definitely it's not dependence forming, it's non-addictive, which is a big concern with something like Xanax. L-theanine is another really effective way to kind of slow down the child's brain. When I hear a patient tell me, or a mother or a father tell me that their child has racing thoughts, immediately L-theanine comes to mind, because L-theanine is so effective at kind of slowing those racing thoughts. It does not help. It does not stop somebody from thinking well. It does not slow thoughts, period. It just kind of tames those racing, worried, OCD, anxious thoughts. L-theanine is often given with GABA, and they're safe to give together, effective to give together, and you'll often find it in formulations together. So one of the products that I use frequently, both for kids and for adults, is a GABA plus L-theanine combo. Remember how I talked about high histamine or under-methylation being at least related to, if not a cause of anxiety and OCD? Well, methylation requires certain vitamins and nutrients to move forward, to happen. Many of those include B vitamins, B1, B6, B9, B12. All of those are really important with methylation, with histamine, and certainly then with anxiety. our kids are often deficient in the B vitamins anyways. And so giving a good dose of B vitamins, methylated B vitamins, can be really helpful in anxiety and OCD. Be careful at first not to overdose, or we can kind of put our kids into hyperdrive at first. So with the B vitamins, it's really nice to be able to start at kind of a fraction of a dose and work your way up slowly over a couple of weeks to the full dose. Another vitamin deficiency can be iron or zinc. And those two things as well, if they're deficient in our children, can be contributing to the anxiety or OCD symptoms they experience. I hope that all of these things together give you some options to try for your child. If you're like me, sometimes you feel really stuck. You're not sure what to try next, or if certain things are safe or not. But all of the things that I've mentioned today are things that really are safe for you to try at home. And I will provide links to many of the things that I talked about in here so that it's easy for you to know this one's okay and you don't have to do any more research on it yourself. So again, I really thank you for joining me. I look forward to seeing you next time and even hearing feedback. What do you think about what we're doing here, and what else would be helpful for you to learn about and to hear? Remember, be gentle with yourself. You're doing a great job.